Okay, so we're going to talk a little bit about cramping. Now, there are a few reasons that people are pretty familiar with of why muscles may cramp. One being dehydration and one being electrolyte imbalance. A lot of times when patients come in, they didn't just exert themselves, so we can essentially assume that those two reasons are not necessarily why the person is cramping. But when we put the person in a position where their muscle is in its most isolated form, and the muscle is not used to firing that way, then it's technically neurologically confused. The British Journal of Sports Medicine came out with an article recently stating that cramping has to do more with poor neurological control rather than dehydration or electrolyte imbalance. So what do you do when you get a cramp? Conventional wisdom or conventional shotgun response is going to be, that really hurts, I want to get rid of that cramp as soon as possible. What we say, which sounds a little bit insane, is we're going to tell you to try to get that cramp to happen even more. The reason why is because when you have a confused muscle and you try to get it to fire more in that confused position, it becomes less confused. You're actually teaching the brain the pattern in which you want that muscle to be firing, and the more you do it, the less it actually cramps, and this time you're actually changing something permanently. You're not just taking care of the pain temporarily. So usually by doing the exercises as prescribed, day 3 or day 4, you're going to notice that your cramping is ceasing to exist. So there's our cramping chat.